Hi, my name is Kristen, and I am a family nurse practitioner student, and I'm doing the abdominal assessment, and this is Mike, and he agreed to be my patient today. First, I'm just going to inspect the abdomen. I'm looking for any masses, any venous patterns, the symmetry, any surface motion that I see, and I do not see any. And I'm also checking for hernias. Go ahead and tuck your chin to your chest. Okay. He does have an umbilical hernia. Okay, go ahead and lean your head back down. Next, I am going to go ahead and auscultate for bowel sounds. And his bowel sounds were normoactive, and I heard them in all 4 quadrants. Next, I'm going to auscultate for the abdominal aorta. For bruits, none heard. And then the renal arteries, none heard. And I also auscultated the iliac arteries, and I did not hear any bruits. And I would also do the femoral on a regular exam also. Next, I am just going to go ahead and palpate. I'm looking right here. I'm just going to lightly palpate, or I'm going to percuss now, actually. I'm going to just look at the abdomen. I'm going to percuss all of the areas of the abdomen. Tympany is heard. Okay. And all 4 quadrants were tympanic. Next, I'm going to percuss for the liver. I'm going to percuss up at the midclavicular line. Okay, and anywhere from 6 to 12 centimeters is normal, and that's what his was, about 7 centimeters. Next, I'm going to percuss for the spleen. Go ahead and put your arm up. Yeah, there you go. And there's some splenic dullness, but it's not very apparent. Next, I am going to go ahead and start my palpation. I am going to just lightly palpate, see if there's any tenderness by looking at the patient's face. Okay, and I did not see any grimacing on his face at all whenever I did that. Next, I'm going to more hardly palpate all 4 quadrants. Was that tender? No. Okay. And I'm going to palpate around the belly button. I know it is tender from this hernia. And it is pretty soft inside of the umbilicus. Alright, I'm going to palpate for your liver now. So what I'm going to do is have you take a big deep breath in. Okay, let it out. And I could not feel his liver. Sometimes you can feel the lower border of the liver. I'm going to next palpate for the spleen. And I'm just going to go on this side at the mid-axillary line. And I did not feel the spleen. It is usually not felt unless there is abnormalities or it is enlarged. Next, I'm going to palpate for the left kidney. I'm going to put my hand underneath his left side and and I'm going to, you can just lean back. I'm going to push up. And I did not feel it. The left kidney is usually not felt on examination. Sometimes the right can be felt on examination. I'm going to next palpate the right. Put my hand underneath his right flank to kind of displace it upwards. And I did not feel that also. Next, I'm going to try to palpate the gallbladder also. And that'll be right next to the liver, more midline. And I did not feel the gallbladder, and that is a normal finding. Next, I am going to just palpate for the abdominal aorta and check for any pulsations. It's just left of midline. Okay, I did not feel any pulsations that could possibly indicate an aneurysm. And I'm finally just kind of like looking overall at and see if there's any masses. And I do not see any masses just by looking, besides the irregularity of the belly button. And I'm just going to go ahead and have you sit up and go ahead and sit on the other edge of the bed. We are going to test for any sort of tenderness with the kidneys. And so I'm going to palpate at the crossovertebral angle. Was that tender?
No.
Okay. All right. And so he had no tenderness in his kidneys. And that finishes up my abdominal assessment. Thank you.